Okay, great. Yes, so hi, my name is Henrik, CEO and co-founder of Abbis. I would like you to imagine a situation where your family member might be in need of urgent care. They have lost their ability to speak, and they solely rely on you to make the care decision for them. That is the situation for pets and their pet parents. And as pets are the most important thing for them, they do not want to screw that decision up. So what do? It doesn't work. Yes. Okay. Maybe I can close this also. So they call vet clinics, but the vet prices are higher than ever. So then they turn to Google, but there's too much irrelevant information all over the internet. So how can they know what's valuable, meaningful, and truthful, and right for their pet and their situation? Where the solution we figured is kind of simple. We want to flip the current system around. We want to connect pet parents first with the trusted info and then guide them to the best possible care. And the idea came from human Medicare side, but we're a vet tech company. So we inspired from Oma Olo, Kanta, and Puhti kind of services to bring them all under one roof and make an ecosystem that benefits the pet owners unlike anything else. And the market opportunity is kind of ideal for us since other providers are focusing on reactive and single function care. And we have the aspect of becoming the preventive ecosystem that benefits all the stakeholders, clinics, pet owners, and insurance companies. The business model we offer is a three-tier: free, basic, and premium. So on the free tier, we offer certain features for free because we want to benefit the pet owners. And still, the lab test and the single purchase items we sell have higher profit margins, so we can make money out of that tier also. But when the user enters the subscription model, we can lessen the profit margins on the single purchase items, so making them significantly more affordable, but still gain more revenue per user on every single tier we're growing up. And the Abbis 2.0 offers this freelancing model for vets and techs, so we can bring to B2B revenue also. Well, the team consists of I, Abbis, and Rebecca, and Abba is Abbis, the name partner. So we know vet, tech, and finance, and most importantly, pets. So we have all the problem aspects acknowledged, so we can have a strong foundation and a valuable solution. And the traction is huge. The owners are supporting us through the surveys and the interviews we have made. And the vet clinics actually see us as a long-term partner to drive growth and revenue for them. So we have some pilots coming up next year. The case study started our go-to-market, where we tested the POC with a group of pet parents and got 71% of them turned to early access paid for Abbis 1.0. So now we focus on social media campaigns and out-of-home marketing on southern Finland to max the pilots we have coming up with the clinics, so we can 10x the clinics through their partners. And then when we have Finland, we can go to Nordics through the insurance services we train to aim. So the ask for now is 150K to make the acceleration of the product development go even faster and max the pilots with the clinics so we are able to do what we want to scale. And then after these ones, the more pilots we want to launch and grow to 1,000 paying users. The cap table now consists of the founders, and after round we insist on retaining 75% with the 5% option pool. So this is personal for us, and we want investors and advisors who feel the same way. We want strong alignment, because that's the way we can assure that Abbis will speak for them who cannot speak for themselves. Thank you.
Questions?
So in terms of partnerships with clinics or veterinary clinics, would you now basically replace First Vet's offering or somewhere before First Vet?
Thank you for the great question. We mainly want to offer not online veterinary service, but we want to offer a second optional way for like pet owners to find valuable, trusted source of information and gain reliable data like through lab tests or something else. So they can get the data first and see the information so they can make the better decision and then find the right vet at the right time if needed. And if not needed, they can save money and not make the unnecessary call or unnecessary visit.
If your business model is a winning one, what prevents others from adopting it? Is it you accumulating the clinic partners faster than others?
Well, another great question, thank you. Well, the business model now consists that we have the tier of the subscription, so people can still benefit from the free model, so anyone can adopt the free model, of course. But since we have the new way of making the tier after subscription like significantly more affordable, and no other provider is doing it yet. So of course they can use it, but we will be at the first at the market.
Hey, thanks for the pitch. Can you open a little bit, where does your advice come from so that it's better than what Google is currently providing, and who, I guess, takes the responsibility of that advice?
Yes, another great question. Well, our advice comes from, since I and another co-founder are vets, so we have the treatment procedure guidelines, how we approach the problems. So we combine the open source data that you can find from Google and with the closed source data that we can only as vets provide. So then we have the combination of that to make the most clear route how to proceed with every single problem. And we use prompt analysis to understand the problem that the user has with keywords and try ask questions so we can provide the clear option of what to do and when to do it.
And can you comment on the international expansion plan? So do you have any, or is it coming, or how does it look like?
Well, on this level now we are focusing on Finland to establish some basic grounds and then go to Nordics, since this is pretty easily done through, because the legal instruments are kind of similar in the Nordics. After that, we can aim to Europe and Asia markets like China, which is massively growing as Gen Z are adopting more pets than they're making children or becoming parents. They're becoming pet parents. So maybe USA and China are actually also valuable options, but since now the Nordics are the main focus. Thank you.
Okay, once again, round of applause to Abis. Thanks. So next up is Brett Noam Analytics. Please, the floor is yours. Brett Noam. Okay, there it is. Great. Yeah.
Frustration. That is what 75% of people trying to lose weight feels at some point before giving up. The psychological impact is negative, that's for sure. But as a society, we need to worry about this as well, with obesity being #1 of chronic disease. And people is doing usually everything very well. They exercise, they eat, they sleep. But after weeks or 1 month, 2 months, they go to the mirror, they check themselves, and they don't see any result. What happened then? Motivation collapse, and people give up. We want to be there for those people. We want to tell them that they are doing things right. We want to show them they are in the right path before they give up. So we start analyzing breath biomarkers with machine learning and advanced sensors. Machine learning makes us special because it learns from every input the user gives, providing personalized insights, because your metabolism is unique. As you might know, when you burn fat, your liver produces ketones, which are break up in acetones, and that's the biomarker we analyze in the breath. So we provide to the user with that information. We tell if the energy source is fats or carbs. This allows the users to adapt meals training routines or fasting periods accordingly. So our product is a breath analyzer combined with a very intuitive app. Market is huge, with 45% of adult population trying at least once in their life to lose weight. We are going to the market first, B2B. This will allow us to test the product, get feedback, iterate, and make a better product. After that, we will focus on the marketing and end with B2C. Scalability is huge, with many breath biomarkers linked to health issues or diseases. So we are aiming to go clinical in future. Our team is, we are 2 people. Elena, my co-founder, she's the CTO. She has experience building custom LLM service for companies like Van Lan. And I'm ex-GE Healthcare. I know how to build medical devices, so I am pretty confident when building a wellness device. In 8 months, we have built 2 prototypes, and we are currently developing our mobile app. We have already early AI algorithms that can prove and identify whether the breath is coming from digestive processes versus fasting periods. And we have participated on those 3 accelerators already. So we have a very strong network. Many startups crash because they don't have a clear product market fit. So our ask is, if you have ever tried to lose weight, you can scan that QR code and book a meeting with me. We want to know our users' needs. We want to understand our users to create the perfect product for them, minimizing the product market fit risk as much as possible. Thank you very much.
Thank you.
My name is Javier.
Right on time. So the jury.
Thank you for a very interesting solution and presentation. So one question, you're mentioning B2B, that you're targeting B2B initially. Can you elaborate a bit more on that and what you're meaning with
Yeah,
B2B?
we thought that we could make a SDK file, so it's something that some of the companies like nutrition apps or gyms that have their own app, they could combine our SDK file with their product, allowing them to just give this breath analysis to their customers through us. So we will sell our device hardware to them, and then they could resell it to the final customer.
Thank you very much. The wellness competition is super fierce. What's your estimation about the timeline to take it to the clinical, which you have in the scalability slide?
I don't have an estimation.
Okay.
Yeah.
Same question.
Can you elaborate a little bit about the, I guess the, like continuously providing value to the end user? Like I'd imagine that, you know, after a week breathing to this analyzer, I figured out quite well if I'm burning fat or still running on carbs. So is there more value add to the end user on this?
Yeah, so what is the value for the end user? Is that your question?
I guess after the sort of initially figuring out how should I change what I eat, mainly burning fats. So what's the next stage?
Yeah, I forgot to say that we provide also with tips to the customer. So depending on the analysis, they could have a tip or another, like we would advise them to, for example, if the energy source is carbs, even in the morning after fasting, then one advice could be like you can go for a walk before breakfast and then change your typical porridge for some more protein-based breakfast, for example, something like that. And the user could then adapt the training, so going for a walk, and also the nutrition, like, for example, changing the macros in the breakfast.
Yeah, Thank you. Thank you a lot for your
Thank you.
presentation. So one more. So I think you can go quite far with this metabolic analysis, and as the clinical path is far away. So could you open a little bit? What do you mean with this oral health, quitting smoking, and alcohol impact score?
Yeah.
And when would that phase come?
Yeah. Well, first we have to be 100% sure that there is a market and there are clients paying for this, for the metabolic analysis. After that, it would be quite easy to go for the oral health because there are many biomarkers related with, for example, if you have caries or something like that. I don't know. Of course, we could scale as wellness first. I don't know how long it's going to take until we can help, for example, motivating people quitting smoke. We can tell them easily from breath biomarkers like, hey, today your lungs absorb much more oxygen than yesterday. And that could be one of the next steps. But for the clinical, that's I cannot now tell like how many years it's going to take. But we are working hard and yeah.
Next up, Ankerias. You have 4 minutes. Yeah.
Okay. Hi. Ankerias transforms chronic pain with AI for precise treatment, less opioids, and less pain for millions of patients. Think that every 5th person around you suffers from chronic pain in some part of their life. Hundreds of millions of patients suffer from neuropathic pain, which is too often treated with opioids. It's bad because there are much better options available. For example, spinal cord stimulation, which is a small device inserted to spinal cord and producing mild electrical pulses to spinal cord. However, over 95% of suitable patients are left with the traditional treatments. Ankerias AI tool will find patients earlier to these treatments. We are providing platform to find patients early and personalize those treatments. And during the surgery, we are also helping the surgeons in the operation. And after the surgery, we are also personalizing those treatments. So eventually, we are providing AI-driven neuropathic pain platform. First starting from SCS monitoring, and then to surgeons' tools, and to our main product, the spinal cord stimulation selection tool and personalization tool. And in the future, we will have wearable sensor, and with that, we will provide an AI-driven neuropathic pain platform. So our SCS selection tool will optimize patient journey to these treatments, and only in UK, we will find 100,000 patients to these treatments. This SCS treatment is really effective and saving healthcare costs. So one patient will save 10,000 euros within 2 years. Our customers are healthcare providers and payers and medical device companies. So chronic pain market is huge, $80 billion, and our niche SCS market is $1 billion. We will have subscription and saving models and to healthcare providers and payers, and later licensing to medical device companies. We will start pilots in Kuopio this year and heading to Nordics, Europe, and USA within 4 years. Our revenue will reach 78 million by 2031. We will provide early, precise targeting with AI. So we already have SCS monitoring tools and surgeon tools and heading to pilots with those, and we are also moving pilots with SCS selection tool. We have done market validation and IP validation studies and collaborated with Kuopio and Oulu universities. I'm Hanna Viisanen-Kuopila, the former neuroscientist, and now my passion is to combine neuroscience, clinical insights, and AI to build this system. The other founder is Riku Tikkanen, the AI and machine learning expert. Our team consists AI, clinical, and business experts. So now we are looking for 250K and now already have 30,000 soft commitment. So we are using this money for patent applications and moving our product to pilots and starting the quality management system. Let's treat chronic pain together. Thank you.
Hi, thanks for the presentation. Could you tell me more about the pilot in Kuopio? How did you get it and what's that going to entail?
Yes, so we have close collaboration with neurosurgeon Mette. Mette Nissen, she's neurosurgeon and a clinical practitioner in Kuopio, so she's starting to test our products in the surgery room and also this SCS monitoring tool. And also next year, this first version of this selection tool.
Thank you.
Thank you very much. I think the unmet need is unquestionable, but there will be a lot of awareness building within the medical community. How are you planning to tackle that?
Sorry?
The awareness building that's required in the medical community to push this through. How are you planning to tackle that?
Yeah, so I have discussed with many neurosurgeons and anesthesiologists and also orthopedics, and they think that this is really needed and patients are really needed in this special care. So we are tackled to find them from the primary healthcare to hospital setting.
Very secondary question, but is this the same Mikko Pitkänen who is working in both of the
yes,
teams? Yeah, okay. So how is his time be enough? It's enough. Yeah, you can split you in two. Good. Okay. Thanks.
So thank you for the presentation. This is very much. It would be good when working with preventive healthcare, for sure. And you mentioned that you're working with insurance companies. Can you elaborate a little bit more on the play on insurance?
Yeah, so of course, depending from the country, the payers are different. So insurance companies are main payers in Europe and USA especially. But also Finland, some of the patients are having injury, like because of work, some kind of accident. So insurance companies are perhaps also interested to find better treatments to those patients.
Okay, thank you again, Andreas. Thank you.
Yeah, thank you.
So next up is Inli Sol. So please come to the stage. Thank you.
Okay, it's the hard truth is that we are failing our elderly. Everybody have a story. Your parent, maybe your relative, maybe yourself, who fell down and couldn't get the help until the next day. This is the silent crisis of the humanity we shouldn't underestimate. Falls are common in elderly care, and it happens typically during the night. When the person is trying to reach the toilet, example, think about the loss of the dignity when the person has been found out on the next day, lying in own waste, or even worse, injured badly to hitting the furniture. And there is no automated remote solutions available to calling help. Did you know that in typical care homes, there is only 2 nurses available in night shift for over 60 residents? It is very highly stressful job environment, And this nowadays is very difficult to get professional staff members. And did you know also that one, that the care data, it's nowadays is the one of the few data elements which are not systematically used on the whole planet for the common good. Ingersoll is the ambassador of the age technology. No cameras, no wearables. You just take our VoIP-enabled radar, attaching that on the wall, plug and play, all the features in the use. Fall detection example. Attendo, the biggest Nordic healthcare provider, is currently deploying our solutions in 6 nursing homes in Finland. We just signed the contract with Voipenkartano, Espoo, Vantaa, and they also started deploying us. And also, we are integrating our solution together with Palvelukeskus Helsinki. Our solution, it's enabling functions, and it's also starting to kind of collecting information on the way that we enable in eventually to AI. Think about the situation once we have tens of thousands of the elderly people, and we have enough data so we can already enable it to AI. And eventually start to extending life quality. We're planning to do the same than the smart devices did for the cameras and radios. We're merging the different technologies together and enabling the aid technology for the use of the elderly and speed up the deployment. We are currently looking for 300,000 euro, and we already collected for 180,000 euro to expanding our value chain activations and our business. Thank you.
Thank you.
Thank you very much. A field that we all care about a lot. Your solution, are you an integrator of existing technologies, or are you an inventor of a part of that solution?
We are part of the solution, so we're using the third-party sensors in our solution.
Thank you very much. So you plan to sell the product and service to elderly care homes, not homes, private homes? No.
Actually, we're planning to also eventually to sell to the private homes. So currently we have 3 different segments.
Yeah.
So one is the elderly homes, then we have a home care, and next year we start the piloting also for the consumer product in the home environment.
Yeah, but what is the reach of one box if there are several rooms in private homes?
So practically you need to have one sensor in every room.
Yeah, that's what I mean.
Full
Yeah.
monitoring.
Yes. Yeah. Thank you.
Can you elaborate a bit on the competitive landscape? With the sensors in the different rooms, there is one specific company in Denmark called Titan AI, which is very interesting and has raised a pretty big round quite recently. So if you could just elaborate a bit on how you would compete with them, for instance.
Yeah, this is the excellent question, and I'm hearing this very often, actually. I would say that there is a lot of companies who are trying to enter into this market, and the penetration is very challenging for most of the companies. But only thing what I can say from behalf of the Ingersoll, so we penetrated into biggest Nordic healthcare providers. We are shipping for them, so we managed to make this stuff working. And I think that's one of the benefits what we have. And I think one of the other one, which we're hearing also from our client directly, we also enabling the phone call possibility through our solution. So this is also acting as the phone. It's not only for radar.
Hey, congrats on the Attendo deal. But how are you planning to go outside of Finland?
Yes, we're planning to go outside of Finland. So Attendo is the strategical solution for us because they have also the operations in Sweden and Denmark. So this is our natural growth in the Nordics. And we already have the activities in DACH area, in German-speaking areas.
So next up we'll have Kommu, that they have something very different and interesting to hear next. And you have 4 minutes sharp. Kristina, start the time.
So, moi everybody. My name is Sami Ekmark and I'm the one of the Kommu app founders. And Kommu is like a Tinder, but for good deeds. So Kommu connects people who want to help to those who need help. What helping in Kommu means? It can be all kind of neighborhood helping. It can be food and material support for those who need it. It can be help in Ukraine crisis, or it can be non-profit volunteering. To our users, Kommu is free, but cities pay us to have turnkey solution to tackle social issues such loneliness and integration problems. More people help each other, less service costs for cities. In a cooperation, city get access to local data, what's happening in the area, what kind of help is needed, what kind of help is offered, and our business model makes us very different than all of our competitors. Example, Facebook and Nextdoor. We started this full-timely little bit over 3 years ago, and currently we have over 100,000 users in 4 different countries. In our past, we have won multiple quite big awards, mentioning 2, one by United Nations for helping Ukrainians, and 1 by becoming best social innovation for cities in Nordic countries. This year, we reached profitability and have agreed or collected 300,000 revenue already. And we have agreed also another 300,000 sales for the 2026 year. This is our founder team. Ronnie has built Kommu. Me, I'm psychiatric nurse, so I'm doing sales here. And Karoliina is doing marketing and is our superwoman and reached million social media views every month approximately. This year we got 2 big steps. One, we prove that we can be a profitable company, and the second one, we prove our business model scale also outside of Finland. Because of that, we are raising 600,000 seed round to build better technology and scale our sales. Thank you.
Thank you for the presentation. Since help is usually or most often free, how do you monetize your product?
Cities pay to us to increase communality and vitality in the area through cooperation. So the users are not paying, and it's actually not allowed to help through money in our platform, but cities use it as a tool.
Okay.
Cities are our main customers. There are companies and non-profits also, but cities are the main thing now.
And how do the contracts with the cities look like? How large are they, and for how long would they be?
We do yearly cooperation with cities currently, and the medium price for the cooperation is a little bit over 5,000 euros so far. But we started with cities 2 years ago, and the small one joined it first. So I think in the next year, the medium price for the yearly cooperation will be 7,000–8,000 euros per year per customer.
Thank you.
Do you have a concrete example on, for example, what exactly cities want to get from the platform?
One, they have problems of integration of immigrants. They use helping as a tool to give to people to get to know each other, to solve the issue of people not knowing each other. That's the one which works Sweden quite well. Second is that in Finland, in Lapland, there is quite big, how do you say it? One people living here and one people living there. So the distance between people, thank you. So they use it as a tool to increase people giving car rides to each other in the supermarket. That's one example. Third example is that elderlies are actually quite lonely at living home, and public sector have problems to take care of them. So actually helping and volunteering is quite good way to tackle these issues when elderlies are living at home, and many customers are buying because of that. There are 3 examples.
Do you have to make some edits in your platform for every new campaign, or?
No,
Okay.
no.
So tell us something about the volunteers who are helping. Is it how difficult it is to get them along, and how do you reach them?
So basically how to get users using Commo?
No. The helpers.
Yeah.
Yeah.
I would say that because if you look at the research right now, we can see that people are quite heavily would like to do something to make a better world. So we reach million views every month in our marketing. So through our marketing and through our with the customers in our marketing, we actually get quite heavily users downloading Commo and using the platform. So that's not a problem.
Okay, great. Thank you, Commo.
Thank you.
Yeah. Okay, next up, Corneasens.
Diabetes. Sounds pretty scary, right? And it is. Diabetes costs the world about 1 trillion annually, and most of it comes from treating complications, which could have been avoided if there was a tool for it. I'm Anton from Corneasens team, and we believe that we can make this early detection simple, fast, completely non-invasive, using the eye as a window to metabolic health. Corneasens is Class 2 medical diagnostic device. It's a combination of optical coherence tomography, which is gold standard for ophthalmologists, and terahertz illumination. Corneasens can measure corneal hydration nearly in real time, providing possibly a new physiological proxy to the disease. We have very strong IP, being also a research to business project, with 1 PCT application filed and 2 invention disclosures coming, or actually submitted and will be submitted as patents. What's the connection to diabetes? Cornea is about 80% water, and for cornea to stay hydrated, to stay healthy, it must keep the balance of water in order, and it's regulated by passive inflow of water from aqueous humor into the cornea, and then active mechanism to pump out the excessive water from cornea to aqueous humor. With diabetes, this balance is compromised, leading to cornea becoming overhydrated. But there was no any method to track these changes in real time, and this is where Corneasens comes in. We're targeting optometric clinics, eye clinics, and pharmacies with total addressable market of about 3.2 billion, and we really stand out. We require no consumables, under 5 minutes time, not invasive, an ideal combination for point of care early diagnostics. And even with 5% market penetration, in 10 years, we can still reach about 23 million in sales. So the revenue is coming as a mix of hardware device sales, device subscriptions, and pay-per-test model, with a healthy 40 to 60% margin. And all of these models have been validated talking to potential customers, optometry clinics, eye clinics, and pharmacies. And later on, we'll expand into pharmacy data packages for those pharma companies developing drugs for diabetes, as well as licensed tech to medical device companies. Our go-to-market is 2-phase approach to de-risk it as much as we can. Phase 1 being validation, and then early sales to optometry clinics and eye clinics as a corneal hydration measurement tool, and there's already a lot of interest in this. And as we accumulate more evidence, we move to the second generation of phase 2, which is going into early screening of diabetes. We have a great team. We complement each other nicely. Two of the team members are there, Mikko and Irina. And this is what we are after. So we're looking for 200,000 from angel investors. We already have 70K committed. So we're missing 130K total from at least 2 more angels so we can close the round. And then the angel funds will be matched by Investor Fund, hopefully. Yeah, that's about it. The funds will allow us to de-risk technical risk or retire the tech risk of moving from phantoms to humans. Thank you. Please come talk to me more about that. Thank you.
Great.
Thank you. And can you elaborate how can you pretty much detect the diabetes early, since it requires like a long follow-up time? So how can you prove it that you can do it?
Yeah, this is something that we're missing now. So we're missing human data altogether, and this is the focus for next year. So we can de-risk it as much as we can. And the funds that we're fundraising now, this is exactly for that. So we can first make sure that technology works on humans. We started early studies. We have some good data already. We can talk about it if you're interested. And then we move on by adding diagnostic claims or medical claims, diabetes, and this is why we want to go stage by stage. So first we go with a medical device as kind of providing additional information to doctors, and second we add diabetes claims. With this kind of approach, we can de-risk it as much as we can, as I mentioned.
Thank you. How far are you from market?
2027, we can start with the FDA approvals, and we're now having a regulatory roadmap being prepared. And then so we can hit the market with the first generation about early 2028.
I did like your this sort of competitive map. However, I think there are some solutions out there which are doing the early detection from the retinal scanning. How do you? Because that seems to be the strong point for you.
Retina, any kind of retinal changes, they come a bit later than corneal changes. This is something that we have yet to prove, but there's some literature suggesting that corneal changes that happen before retinal changes. So that's the core idea.
Right. You mentioned device sales, paper test, and subscription. So how do you see the split going, and what would the subscription entail?
Yeah, so we talked to about 50 different customer groups, not groups, but customers, so pharmacies, optometry clinics, and eye clinics and optometry clinics. They prefer to have one-off. They just buy it once and then they make use of it. Pharmacists want to have paper test model, and then some of them want to have subscription-based as well. So subscription will be about 1,500 a month, and one-off will be about 50K, and then just own it. And one test will be roughly about 20 euros. So that's the idea.
Okay, thank you so much, Cornelius. Round of applause again. Okay, now it's Neozir.
Okay, hello. I'm presenting Neozir, and if you have wondered, Zir stays for vision in Ukrainian. So we are presenting your new vision. Overall, we live better and healthier and longer lives than our ancestors did. But one part of our body particularly doesn't like our lifestyle, and this is our eyes. Now, only a few generations earlier, only 1% or several percent of unfortunate people who are genetically predisposed to nearsightedness, myopia, they had to suffer the consequences. And now you see the numbers, and you can pretty much look around the class in a university how many people after school are myopic and have to wear glasses. And the reason is that we don't want and we can't change our lifestyle. And what is it if we don't need to? So our solution is mirror-based optical system, a monitor which is designed that your eyes don't focus on the distance of 30 to 50 centimeters as it is now, but they are focused basically on an infinity. So there is no eye strain when you look at the screen. And this is our bulky proof of concept and the render of how it will look for the end user. So you can imagine here in Kaisatalo, students, dozens and hundreds of them, coming with their laptops and plugging their laptop to their desktop monitor and walking and having their screen time on eye-friendly basis. And market is all office workers, public places where people use computers, and it's huge, you see the numbers. And we are targeting direct sales to education and enterprise customers, and also licensing their technology to display manufacturers. Competitors are myopia prevention market, because now we don't treat myopia. We only either mitigate the consequence, so it's glasses, lenses, and surgery, or we are trying to slow it down, to slow down the onset, but there is no cure. And potentially there are on market also virtual
30 seconds.
displays, and they are targeting now gaming market. We are looking now for funding 200,000 to 300,000 to do demo-ready prototype, usability testing, form the advisory board, and international patent filing. And here is our 100% myopic team. Join us to stop myopia pandemic. Thank you.
Thank you for the presentation. What does join us mean? Are you looking for funding?
Yes, we're looking for angel money.
Okay. Do you have more? How much?
200,000 to 300,000.
Okay. Thanks.
Thank you. Can you tell us how much the device costs?
In mass production, it's 300 euros. Estimated cost. So it's really cheap in mass production.
And that's the price for the end user?
Yes.
Yeah, okay.
Okay, thank you so much.
Thank you. Thank you very much.
Hello, my name is Rosa Kivari and I'm co-founder of Dermeco. And in Dermeco, we are created the first and only biodegradable hydrocolloid dressing in the world. So the problem itself is the waste. So hydrocolloid dressings create 30 million kilograms of waste annually. And one plasters take 400 years to decompose into nature. And our solution is biodegradable hydrocolloid dressing. So it decomposes into carbon dioxide, water, and humus, and does not break into harmful microplastics. So here you can see our product is really simple. We have 3 layers. We have a lamination film on top, then we have an adhesive layer and hydrocolloid layer. And the companies at the moment, like Combeer, they are using plastic film on top, and also they use hydrocolloid dressings with synthetic components. So our market can be divided in 4 categories, depends the end product. We have a traditional, acne beauty, for pimple patches, advanced for hospital, and other applications, example, ostomy bags. So hydrocolloid total market is 2.5 billion. And the main growth drivers are EU plastic taxes and ESG benefits. So we have a strong patent portfolio. We have our main patent combine biodegradable film and hydrocolloid dressing. And then we have also patent for the hydrocolloid unique receipt. So we're already been talking about major players on the hydrocolloid market. And we are currently negotiating with the next steps with them. But sometimes we are finalizing our product development on end of this year. So here you see we are finalizing product development, and then beginning of the next year we are going to negotiations with the potential customers, and on the same time we are starting the testing of the product that we can have the right certifications. We have a strong team with expertise to take this product into the market. And we are looking for raise funds, €500,000 convertible loan. So we are going to use the money finalize the product development, which is 90% ready, and then testing. Yeah. So thank you, and we are, okay, I was more faster maybe. So we are based on Terkko Health Hub in Finland, and also my colleague is living in USA. So any questions? So you can find our booth today or tomorrow. Thank you.
So thank you for your presentation. So what are your terms on the convertible loan?
I have to say that maybe Sami, our CIO, can answer later of these details about, yeah.
Okay, thank you.
Can you explain a bit more on the partners that you're negotiating with right now? How are you expecting them to work with you, basically?
Yeah, we have a few partners, and we are planning to do piloting. So when we are finalized these last steps with our product in Finland, we are going to make pilot lining with one of our customer, and then maybe from here we are planning to license our technology.
Is your solution cost competitive at scale?
Yes, it is only the biodegradable hydrocolloid is as any hydrocolloid, is the same price. But only the biodegradable film is a little bit more expensive. But if you see the end product, you don't use it that much. So maybe double the biofilm. But it's not any deal breakers from the clients. We already told them.
All right, thank you.
Okay, thank you so much for the presentation.
Thank you.
Thank you.